Stop right there. Don't dismiss the one body you get. Let's not call suffering normal just because it's common. Let's not wait until something is completely broken before we pay attention. On today's round, we're picking up where we left off, turning everything we learned about lab ranges into something you can actually do something with. If you missed the last episode, hit pause and go back because today's going to make a lot more sense if you've heard it. Welcome to Playing for Life, the podcast where golf, hormones, and midlife performance are finally in the same conversation. I'm Dr. Amy Garza, a midlife hormone expert, aspiring competitive golfer, and someone who believes better performance starts from the inside out. On this show, we connect what's happening in your body to how you show up on and off the course. It's about building a body that lets you live better, play better, and stay in the game longer. Because midlife is not where you stop playing, it's where you learn how to play for life. Let's tee it up. Quick recap. Last round, we talked about how lab ranges actually get made. They take a big group of people, throw out the top and bottom 2.5%, and call whatever's left the normal range. We talked about why that means normal really just means common, and common isn't the same as healthy. We talked about how your personal range is way tighter than the lab's range, which means a 20% drop from where you used to function can still look in range on paper. And we landed on this phrase: the range is not the target. Today, we're going to take all of that and ask, so what do we actually do with it? What does it look like in real life when your labs say you're fine, but your body is telling a completely different story? And how do you start having a smarter conversation with your doctor without making them defensive? A quick note, because I'm a doctor, but I'm not your doctor. This episode is for education only. Use it to have a smarter conversation with your own clinician. Let's start with women. I cannot tell you how many women I've seen who are somewhere in their late 30s or early 40s, sometimes mid 40s, and they're told there's no way they're in perimenopause because they still have regular periods. And I want to be so clear. You can have regular periods and absolutely be in perimenopause, at least be having hormonal shifts. In fact, that's often exactly how it starts. I don't care what your board certified OBGYN told you. I promise you can be symptomatic for hormonal shifts and still have regular periods. This is a hill I am willing to die on. It doesn't always begin with skipped periods. Sometimes it begins with heavier periods. Sometimes it's anxiety or waking up at 3 a.m. or rage that feels completely out of proportion to the situation. Sometimes it's headaches, night sweats, more PMS, breast tenderness, brain fog, or just this feeling of I don't feel like myself anymore. And then, because the periods are still coming, you're told, no, you're too young, or your cycles are regular, or your labs are normal, or some other thing. Meanwhile, you're still suffering, and your family is suffering. Picture this. You love golf. You signed up for the member guest months ago. You're excited about it. If your partner picked, your matching outfits are ready, and maybe you even took a lesson because you actually want to play well. And then your period comes. Not just a normal period, a heavy, painful, exhausting kind of period. The kind where you're worried about bleeding through your clothes period. The kind where you have to know where every bathroom is, where you're cramping, uncomfortable, exhausted, and just over it. And instead of enjoying the tournament, instead of being present with your friends, instead of competing and having fun, you have to withdraw. Or you play, but you spend the whole day managing your body instead of playing your game. And then someone tells you one of two things. Well, your periods are regular, so it can't be hormones. Or have a surgery or a procedure, or here's some birth control pills to make it all go away. No one is really addressing the underlying problem. It's absolutely maddening. Heavier periods can absolutely be one of the first signs of perimenopause. And remember, from our earlier episodes, progesterone is the first hormone that starts to decline, often in our mid 30s. So if you're a woman in your late 30s, early 40s, and your periods are getting heavier, your sleep is worse, your mood is shifting, and your body just feels different, you don't have to wait until your periods become irregular for that to count. You don't have to wait for some lab number to be wildly out of range. The signals are already there. And let's talk about birth control for a second, because this is another place where labs can get really tricky. Maybe you're on birth control pills and then you get your labs checked, and someone tries to interpret those labs as if they're telling the entire story about what your ovaries are doing. Birth control changes the hormone landscape. It can suppress natural cycling. It can change what we see on labs. Here's a specific example. Birth control pills tell your liver to make more of a protein called SHBG, or sex hormone binding globulin. It's not super important. It's just this is a protein that grabs onto testosterone and holds it. So your testosterone might look fine on paper, but the amount that's actually free and active in your body could be down by more than half. If someone just looks at that total number and says you're fine, they're missing the whole story. Same thing with your thyroid. The birth control pill raises proteins that carry thyroid hormone. So the thyroid hormones look a little off, and there may be a problem when there isn't one, or vice versa. So if you're on a hormonal birth control, your labs may not be telling us what they would tell us if you weren't taking those hormones. It doesn't mean the labs are useless. It means they have to be interpreted with context. That's the point. Now, let's talk about men, because men get missed too, just in a different way. A lot of men think testosterone is only a conversation they should be having if they're struggling in the bedroom. And yes, erections matter, libido matters, sexual function matters. But testosterone is not only about erections. Like we talked about in previous episodes, testosterone is a vitality hormone, a drive hormone, a muscle hormone. It affects recovery, mood, confidence. It's part of the internal sense of like, I can and I want to. It's that go do the thing kind of energy. When it starts to decline, you might feel it in any number of ways. Maybe you notice a change in the bedroom first, but maybe you notice you're losing muscle, or maybe it's brain fog, less patience, even bouts of depression. If you're one of the lucky few, maybe you only notice it as your golf game starts changing before anything else. This reminds me of a patient I have who's always been really successful at work. He's always been on top of his game, and it's been part of his identity. And golf has been his outlet. And those are the two places where he feels competent. He loves his family deeply, but work and golf are the places where he had always felt like himself until he didn't. By the time he came to us, he didn't know what was wrong, but whatever it was, his life wasn't working. His wife had made him come, and he didn't want to be in my office. He'd already been to his primary care doctor, like she'd made him go to every year, and he'd gotten a clean bill of health. His labs were fine. He didn't understand why we were wasting his time. As we talked, he started to unload. He lost his focus. He'd been blaming new organizational structure he put into place after this recent acquisition. He said it was the younger team and they were distracting him, and all the things were causing him to really struggle. When I asked him about something else, what did he do for fun? He casually said golf, but with enough of an eye roll that it caught me off guard. So I started digging a little deeper. He was already annoyed with me and admitted that he felt like this was a waste of his time. His doctor had said he was fine, his labs were normal. Could we just get this over with so he could get on his way? But when he opened the golf conversation, things shifted. He relaxed a little bit despite that eye roll. You see, at work, he could blame all of those obvious to him external factors. But then golf changed too. And that was harder for him to explain away because the course is honest. He used to have a competitive edge. He used to look forward to playing. He used to hit a ball a certain distance. He used to be able to stay mentally in it for 18 holes. And now he's losing focus. He feels flat. He makes one bad swing and just can't recover emotionally. He's exhausted after rounds, and they used to energize him. And suddenly, the one outlet he had made him feel like another place he was failing. So together, we looked at his labs, and he was right. The total testosterone the doctor checked was normal. But again, what does that even mean? Total testosterone is not the whole story. That total number, even if it's in range, doesn't tell us about free testosterone, the part that's actually available for his body to use. And it definitely doesn't tell us where his number used to be when he felt like himself. Maybe his testosterone's at 450, which is, yes, in the range. But what if it used to be 750? What if his body's been built and calibrated around a higher number for 30 years, and now it's two-thirds of what it was? That's a meaningful change. The reference range can't see that. Only history can. This is why your free testosterone matters, not just your total. This is why symptoms matter. And this is why one isolated lab on one day at one lab company may not be enough. Context, trends, and history matter. Now, let me pause here and say something important. I'm not saying that every man needs testosterone. I'm not saying every tired man has low testosterone. And I'm not saying every bad round is a hormone issue. Please don't hear that. I'm saying testosterone is part of the performance conversation often enough that it deserves to be evaluated thoughtfully. And if you're a man losing his drive, strength, recovery, libido, motivation, mood, or confidence, we just need to ask better questions. And the same is true for women. If you're losing sleep, calm, confidence, desire, motivation, emotional steadiness, focus, or the ability to recover, Just need to ask better questions. And when both people in a relationship are changing, we really need to ask better questions. Because here's another pattern I see all the time. It's heartbreaking. One spouse gets treated and the other gets left behind. And it can happen in either direction, but the version I see the most, because testosterone gets given to men so much more often than women, is that a man gets testosterone and he starts feeling better. His energy, libido, and motivation come back. He wants to play golf all week, get outside, work out, be around people. He feels like himself again. It sounds great, except his wife is at home feeling worse and worse. She's in perimenopause or menopause, sleeping terribly, feels moody and cranky, completely isolated, doesn't feel sexy, and she definitely doesn't feel motivated. She just isn't feeling like herself. She may even feel like she's the problem in the relationship now because he has energy and desire and she doesn't. And that's a really painful mismatch. Maybe you used to play golf together. Maybe that was your thing. You go out on a Saturday, play 9 or 18, have lunch or dinner, talk and laugh, maybe even flirt a little. And now going to the course all the time because he feels great, and she's staying home because she feels overwhelmed, exhausted, huffy, anxious, moody, disconnected, all of it. He may think you don't care. You may think he doesn't see you. He may feel rejected, and you may feel abandoned. Before long, hormones aren't just affecting bodies, they're affecting a marriage. This is one of the reasons I care so much about midlife medicine. This isn't just about lab values. This isn't just about optimizing a number. This isn't just about hitting the ball further. This is about keeping you connected to yourself and to the people you love. It's about helping you stay in the game at home, at work, on the course, in your marriage, in your purpose. That's why normal's not enough. I don't want normal for you if normal means you're technically in range but barely functioning. I don't want normal for you if normal means you're exhausted every afternoon. I don't want normal if normal means you're snapping at your spouse and then crying in the pantry because you don't know why you reacted that way. And I certainly don't want normal if normal means sex has become one more thing to avoid. I don't want you normal if normal means you gave up on the tournament, the trip, the weekend, the workout, or the version of yourself that still wants to be alive and engaged. I want optimal for you. Optimal does not mean reckless. It does not mean more is always better. It doesn't mean that chasing the highest number. It's not what I'm saying. Optimal means we're asking the right questions. Where do you function best? Where do you sleep well? Where do you recover? Where do you have a stable mood, healthy desire? Where do you have strength, clarity, and resilience? And where do you feel most like yourself? It's a very different question than is my number inside the normal range. This is why I practice the way I do. I'm always looking at the whole picture, the whole person. I want you to know your labs. Yes, they really matter. But I also want to know your story. I want to know your symptoms. I want to know what's changed. I want to know what matters to you. I want to know what you want to be able to do with your body. Because for one person, the goal may be getting through the workout without crashing. But for another, it's wanting sex again or sleeping through the night. For someone else, it's playing golf tournaments without your body falling apart. And for someone else still, it's just wanting to stop feeling like a stranger in your own life. Those goals matter. And they matter because medicine should be so much more than reactively keeping you from dying. It should also be about proactively helping you live. Now, I know you might be listening and thinking, okay, but what do I do with this? Because I don't want you to take this episode and walk into your doctor's office and say, I heard on a podcast that you're interpreting my labs wrong. It may not go very well. Honestly, doctors don't love being told how to do their job. I mean, really, no one does, right? So I want to help you have that conversation in a way that's clear, respectful, and useful. First, lead with your symptoms, not with the lab you want. Lead with what has changed. You might say, I know my labs were in range, but I don't feel like myself. I mean, that's a really powerful sentence. You can say, my energy, recovery, libido, sleep, mood, fill in the blank, even focus. It's changed. And I'm trying to understand why. Or you could say, I used to recover well in workouts. Or you could say, I used to recover well after workouts and golf, and now I'm just wiped out for days. Or you could tell your doctor, I'm still having regular periods, but they're heavier. My sleep is worse and my moods feel different. Could this be perimenopause, even though my cycles are regular? Or you could tell your doctor that you understand that your testosterone may be technically in range, but ask if you could talk about the total testosterone, the free testosterone, and the SHBG, and see if it makes sense in context with your symptoms. You can ask if you have old labs that you can compare so you can see if there's a change from where you used to be. Another question I love is, can we talk about whether these labs are optimal rather than just normal? Listen, that's a fair question. It's not accusatory, it's not demanding, it's just fair. And then there's this one. What else could explain the change in my energy, recovery, libido, sleep, whatever the blank you filled in was? Because if the answer is your labs are normal, it's not really an answer to that question. If you don't feel well, the conversation should not end with normal labs. It should move to, okay, if these labs don't explain it, what else should we evaluate? That could include things like sleep, nutrition, or stress. It could be thyroid or metabolic markers. It could be a medication you've been on for years that nobody's questioned. It could be depression. It could be alcohol, be over or under training, or some combination of sex hormones and everything else. It could be all of the above, but you deserve a thoughtful conversation regardless. You deserve to be taken seriously. I want to say something especially to you if you've been dismissed. You are not difficult because you're paying attention. You're not dramatic because you know something is off. And you're not high maintenance because you want to feel better. You've lived in your body your whole life. You know it better than anybody, and you know when something has changed. That doesn't mean you know the diagnosis. It doesn't mean you know the treatment. It doesn't mean every symptom is hormonal, but it does mean your experience is data. And in midlife, symptoms are some of the most important data we have. So stop apologizing for noticing. Let me say this too, because I want to be fair. There's such a thing as overtreating, and there is such a thing as blaming hormones for everything. I'm not interested in that either. But I'm also not interested in you being told you're fine when you're clearly not functioning well. There's a better middle ground. That middle ground is thoughtful, individualized, evidence informed, patient centered care. It's looking at the person and the labs. It's looking at safety and quality of life. It's looking at symptoms and data. It's looking at what's common and what's optimal. It's asking not only, are you sick, but also, are you well? Because those are different things. You can be not sick and still not well. You can be disease free and still not strong. You can be alive and still not fully living. I see this all the time. You come in and you almost feel guilty for being there. You say things like, I know this probably isn't a big deal, or I know my labs are normal. I'm sure everyone is tired. I know this is probably just what getting older is like. I just want to stop you. Stop right there. Don't dismiss the one body you get. Let's not call suffering normal just because it's common. Let's not wait until something is completely broken before we pay attention. It's not how you play good golf. You don't wait until your entire swing falls apart before you notice the pattern. You pay attention to the miss. You notice the drift. You look at the ball flight. You look at what's changed. You get curious. That's what I want you to do with your body. Just get curious. If you're losing distance or your back nine keeps falling apart, get curious. If you're exhausted after a round that used to energize you, get curious. If you're sleeping poorly, your periods are heavier, your libido is gone, or your mood is flat, get curious. If your spouse feels like a stranger or you feel like a stranger to yourself, start asking questions and get curious. Not panicked, not ashamed, curious. Because curiosity opens the door and shame closes it. So many midlife men and women are walking around ashamed of symptoms that actually deserve understanding. Maybe you've been telling yourself you need more discipline, you need to try harder, you need a better attitude, or you just need to accept decline. Sometimes what you actually need is a better assessment. Sometimes you need someone to connect the dots or to understand that normal is not the same as optimal. And sometimes you need to stop treating your body like it's betraying you and start realizing it's communicating with you. That's the message I want you to hear today. Your labs may be normal, but if you don't feel normal, it still matters. Your body isn't wrong because the lab rage says it's fine. Your symptoms are not irrelevant because your number is in range. Your golf game is not separate from this conversation. Your performance is not separate from your physiology. Your marriage is not separate from your hormones. Your motivation, it's not separate from your biology. And your recovery, it isn't different or separate from your metabolic health. They're all connected. And that's good news because connected systems can be understood, they can be supported, they can be rebuilt. It doesn't mean there's always an easy answer. It doesn't mean hormones fix everything. It doesn't mean one prescription changes your whole life. But it does mean there may be more to the story than you're fine. And if you know you're not fine, I want you to keep asking better questions. In the next episode, we're going to widen the lens. We're going to talk about what other lab markers I care about in midlife and why they matter for golf, energy, recovery, body composition, and performance. Because yes, sex hormones matter, but they're not the only thing affecting your back nine. We're going to talk about metabolic health, blood sugar, insulin, thyroid, inflammation, nutrient status, and some of the other markers that can tell us how well your body is actually functioning. Because the goal isn't just to have normal labs. The goal is to build a body that can do for you what you still want to do. For you, that matters because you're not just playing for a score, you're playing for the version of you that still wants to grow, still wants to compete, still wants to be outside, wants to connect, still wants to live well, and still wants to stay in the game. So remember this, the range is not the target. Normal doesn't always mean optimal, and common definitely does not always mean healthy. Your body is not betraying you. It may just be asking you to listen. If something in today's episode hit the sweet spot, do me a favor. Follow the show so you don't miss what's next. And share it with a golfer who's been told everything is normal, but still knows something is off. Especially someone whose body, energy, confidence, marriage, or golf game has changed and they haven't known what to do with that information. Drop a comment and tell me what landed and what you've been told was normal or what you want me to dig into on a future round. Your questions shape where the show goes next. You could go to amygarzamd.com/podcast and anonymously leave a question there. This is Playing for Life. Here's to living better and playing longer. See you on the next tee.